Hey, everybody, and welcome back to another episode of the Bulletproof Dental Practice Podcast. Peter and I are here, and we've been talking for a while before we hit record because it's been a little bit of time since we've last connected. I didn't tell you this, Pete. That Cadillac that I bought in 2023, that was the most expensive vehicle I've ever owned. Because I brought it to CarMax, and they offered me basically like 66% less than I purchased it for. So I'm like looking at the depreciation. I'm like, I could have leased the Bentley. That's what it wound up being. It was crazy.
Yeah. And unfortunately, they get that residual value from the car auctions, and car auctions right now are just getting crushed.
Yeah. So Cadillac, I know they were thinking of sponsoring the podcast.
Yeah.
We still love you, and we'll still be happy to take your money. But man, oh man, that residual's rough.
You know, I had a new one with 12,000 miles on it, and it locked up, and the engine and the transmission went out, and they had to lemon law it.
Yeah. Emily was stuck in the middle of the road, right? I remember she was calling it a tailspin with that.
So anyway.
Yeah, my Cadillac was not a good car. But anyway, first world problems. But now we're buying a Tesla. You know, the funny thing is my wife just texted me. She said,
is there going to be a dental story here?
Yeah, there's a dental story in here.
Good. Just because it's a dental pod, just making sure there's a corollary to what we're talking about.
There will be.
Not just chit chat.
No, I was about to drop the dental corollary, but she said,
I'm kidding.
So the salesperson's not calling her because, they don't work on commission. And she literally said to me, that's why sales-based or commission-based jobs work best. And it made me think because, look, in the dental industry, we have a lot of providers outside of the doctors that do what they do out of the goodness of their own heart. Hygienists recommend treatment that is necessary to help patients keep their teeth a lifetime. But let's face it, it's more work for them and it's more difficult for them. And oftentimes patients are running late, providers are running late, the FMX is due, the scan is due, patients asking about the tooth loss that they've got because they're clenching and grinding. And you just don't have the time to talk about the night guard to take the records for that. And on top of it all, you're not really rewarded to do so in most ecosystems. So there's a big disconnect, I think, especially in the hygiene world, where we have this kind of mid-level provider in the hygienist rather, and the compensation structure not being aligned with a provider type structure. And I look at medicine and see what's happened between doctor, physician assistant, all these mid-level providers. And I see the legislation on a national level where hygienists are having increases in their scope, whether that's laser, local anesthesia, or expanded functions. I'm really long on dental hygiene. I think dental hygiene of the future, they're going to be doing a lot more than they do now. And what does that mean? That means that scope is reduced for dentists and pushed into the hygiene world.
Well, look, I think, Charlie Munger has the quote that everyone reiterates, show me the incentive and I'll show you the outcome. And I think that's where you're saying the parallel is drawn between Tesla and potentially dentistry, right? If 50% effort gets rewarded at 100%, the same as 100% effort gets rewarded at 100%, right? You follow me? Then why should said hygienist do follow-ups or make sure the book is full or be looking 2 weeks out? Because if the day is the day, doesn't matter, right? And so it creates, unfortunately, without some level of incentive, without some level of upside, it's really hard to get high performance. And Elon doesn't really need to do that, right? So if we go back to the Tesla scenario for a second, right? He's made the buying process so streamlined. Like Craig, have you ever bought one? I've never bought one, but everyone tells me that you fill it out in an app. You don't talk to a human. You go pick it up. You walk in there, the car unlocks for you, and you go home. It's all done prior to getting there. So he's created such a better mousetrap that he doesn't have to have the Cadillac salesperson going out and being like, hey, Zaisha, what do you think? Are you ready to go? What's it going to take to get your business today?
And there's no negotiation.
There's no negotiation. It's the price. You've already done it online.
Right.
And so he's created something better, which is, so better, worse. In your scenario, right? You guys actually probably wanted to be reached out to get this deal going, but they don't have to.
Right.
So
and
going back to the dental,
he's trimming back the premium lines too. So, on the earnings call last week or whatever it was, he's discontinuing the Model X and the Model S, which are the two fancy lines. It's 3% of their market share. So he's like, look, the Model X customer like Craig is probably a pain in the ass. wants to be called back and wants all this stuff. And he's like, look, we'll just sell
Well, it's
Model
made
Ys.
for, that's actually not the reason. So what the reason is kind of like the Southwest thing, right? Southwest said, look, Delta, you have 50 types of planes, and therefore we have to have 50 types of mechanics and 50 types of pilots and 50 this and that. So Southwest was like, we're going to buy one kind of plane. We're going to buy the 737, right? And therefore we'll only have 737 pilots, only have so it streamlined it. And therefore, what did that allow them to do? Lower the price point. So everyone knows Southwest is a budget airline. And so it just streamlined that process, which is, I think there is an analog with that in dentistry, right? Like, meaning, and I'm maybe go off on a tangent here a little bit, Craig, but you have lots of doctors, right?
Yes.
Have you ever had the conversation about, like, just for example, bonding agents? Like, this is the bonding agent we're going to use.
It's like saying, can we all agree on one religion?
But so you don't mandate it?
We do, but it's difficult, and everyone has to take a concession. Everyone has to be, take some compromise on it.
Yeah, I think that's the next level. I think, look, growth, and everyone gets to be rogue and have their own clinical autonomy. But ultimately, like, you have to get to the Southwest model, the Elon model. And I was saying how Elon kind of trimmed the fat is because he still has to have different molds and such for all those equipment, right? He still has to have, it's different tech in each one of those cars, different steel panels, different that. In order to drive that price down and really capture the market, he's like, let's go with the Model X. Let's go with the Model Y and the Cybertruck and the Model 3. And that's it, right?
That's it.
Because those are the easiest to make. I can lower the price down and absolutely crush the Fords and the Chevys and the whatevers of the world.
There's another reason. That's his stated reason. You know what that is, right?
To go to Mars?
No, he wants to use the factories that make the X and the S for the Optimus robot.
Oh, okay.
And Jason Calacanis on Twitter the other day said, though, if you've seen the Optimus robot, you will realize that one day you will forget that Tesla ever made cars.
Yeah.
It is that, like, it'll be a relic that they made cars.
To that guy.
No, I know. I don't listen to him either, but you still haven't taken the full self-drive thing, but it's wild. And I want to bring this to another corollary in dentistry too. Those that are building something simplistic and replicable are scaling at a much faster rate than those that are building something one-off and fancy as well.
And Craig, so I think what you're saying here is those who are building something scale, you actually, to the eye of an investor, even though you're never wanting to sell, fine, whatever, but you become a lot more valuable when there's less entropy in your system, right? There's not a bunch of bonding agents. There's not a bunch of labs. There's not a bunch of this. There's not these one-off deals. Oh, well, that hygienist gets a different deal because she's been here as an OG, right? When everything is buttoned up, where X said investor can come in and just take over, that's when the business is more valuable. And ironically, that's when your life is better too, as the dental entrepreneur owner that's listening to this. The hardest point in my career was probably when I was letting people have autonomy and less structure, because I wanted things just, it was speed over everything. And the way to get through that was just grow, and then kind of fix the entropy later. But now, like, honestly, now the non-negotiables are in place. And I got to say, it's like people are just happier. People are just happier because they understand the rules of engagement, right? No one has one-off deals. Well, she gets that. Why don't I? So kind of thing. I know I'm going off on a little bit of a tangent.
I appreciate what you're saying, but I see it just a slight different way. I know what you mean. My system's replicable. I understand all this. One thing I want to point to is that if you just taking the Tesla analogy again, the complexity of high level dentistry. So we look at the typical person that we interact with in a mastermind becomes an extraordinary producer, becomes the FMR surgical implant, high level producer doing, $1, $2, $3, $4 million a year with their own hands. And then they're like, oh, wait, I want to do a business. And those that are, and then, the last master's call was Tanner. And Tanner, we had two calls, one with a high level guy that's, highly educated, does multiple millions with his own hands, FMR type guy. And he's trying to figure out how to scale, how to grow, doesn't want to take insurance, totally get it. He wants to replicate what he has. He wants to scale his job, what he built for himself. And then you have Tanner coming back in and be like, hey, I just want to open up tons of opportunities, go to areas that need dentistry, and we're not going to focus on high-level procedures. We're going to focus on average dentistry so that any dentist coming out of any school with 1 year of experience can thrive in my ecosystem. What's going to grow faster? He's building the Model I of the dental world, and you and I, in many ways, try to build a Model X and Model S.
Well, no, I would say yes. At points in our career, I think we got romantic about being the Model S. You're right.
So are your future practices going to be less concerned with FMR and cosmetics and more concerned with general, if you had to say? Like your next 50 operatories that you plan?
Quite honestly, Greg, yes. I think the primary thesis is human, meaning it's a hub and spoke from a procedural standpoint. I want to go out and get as much general as possible, but then also be there to capture the specialty procedures. But that's not the core premise of the business, is not the all on X. But there will be the people who need that. And so it's, can we keep it in-house? Do we have the in-house quote unquote specialist or super GPs that can capture? But my plan is like yours, is like have as much hygiene and as much general dentistry, simple general dentistry as possible. And then the elevated cases obviously flow up to maybe a different provider.
You know what I realized, by the way? We have two providers, one that does high level stuff, 1.3 million, and one that does more general basic dentistry at 1.2 million. The profitability of Dr. Basic is like 20 to 25% more than Dr. Advanced.
What do you mean the profitability? You mean pound for pound?
Lab costs, lab costs from Dr. Special is, 16%. Even if the comp is the same, it's just complex dentistry is not as profitable as we think it is. It makes us feel good. Maybe for the producer that provides it, it's good because it's a large case. But it's, there is an allure of the full arch and the full mouth. But the complexity and the amount of visits to it.
I think I disagree with that. I think when you dabble in the high complex stuff, yes. But when that's kind of all you do all day, every day, I think you get very proficient at it. Right. But I think when you're the Swiss Army, it's like, I do implants, I do all-on-X, I do veneers, I do root canals. Like one human can't get proficient enough at that. So it's revisits and redos and things like that obviously eat into your economics.
Well, you have to put it all into position. Like it's not just, it's the wax up, it's the trying, it's the adjustment, it's the marketing to market and acquire. An FMR patient is different from acquiring a quadrant. Listen, our ecosystems are different, but I think that if you're listening to this podcast and you really want to be a dental business owner, I think that the easiest and most secure path is to surrender the opportunity of the alluring high-level case. Who cares? Almost. Like it's better off you focus on hygiene and general dentistry, in my opinion, and let the high-level stuff go. I mean, what we're doing and what you've done is you have a high-level practice, so you can now take up a bunch of spokes and have you as a central hub. But if you had 30, 40 offices that are cranking on general dentistry, do you necessarily need to capture that market? I don't know. Just food for thought.
Yeah, it is a good thing. And you started this conversation with the incentive, right? And I think that is a good place to let me pause for a second as I say this. Like, I think that foundational thing. I think we both agree that a strong hygiene, probably in the 25 to 30% of revenues is a good goal. Sometimes even a little bit more. When it starts to exceed that, potentially that could mean that not enough dentistry is being done. But I think there's a good sweet spot. But I think it should be robust, and I think it should be a primary focus of your practice. For so long, Craig, the hygiene and restorative, like you said in the early phases, was just an afterthought. It was just a service, like, oh, go get your teeth cleaned kind of thing. And it wasn't I've said this many times on a podcast before, but I had an old mentor of mine at the Hornbrook group. I can't remember his name now. Mike Majowski. Anyway, I remember him saying, like, this is way back in the day. He's like, I got $1 million hygiene program. And I was trying to get $1 million practice. And I was like, what? How is that even possible? But like what he knew back then is like, look, a lot of the more my hygiene produces, the more the more cosmetic cases I get. And he was a cosmetic guy, right? So he's saying the more robust my hygiene is, the more cases I get. And he's like, it's funny how that happens because I'm having more FaceTime and more butts in chairs and more people are served. So it's a numbers game as opposed to waiting to that perfect pitch that's coming down the pipe, through your marketing. It's like, oh, here it comes, So
No, I know. And you look at that $1 million hygiene practice, and of that, when you do $1 million of dentistry, it's done. It's done. There's no added
Right.
benefit to the $1 million of dentistry. $1 million of hygiene means that there's probably, what would you say, Pete, 30, 50% more work of restorative that came out of that you're not even measuring. The $1 million of hygiene caused blank percentage of restorative work to be sold as well.
Well, I mean, you could probably extrapolate that as an average. You could probably, I don't know the answer to what you're saying,
But it's not.
I'm just thinking
It's more. It's more.
Well, sure. If you take your average production per patient visit, and then you take the delta, like your average across all places, and then you take the delta of what an average hygiene visit is, right? That's probably per unit economics where you follow what I'm saying?
Yeah, of
like,
course.
let's just say hygiene is at 250, but your average production per patient visit is 600. Like the delta is probably 350 times whatever. So that's probably what's left on the bone. I don't know. I'm doing this live.
No, I know what you're saying. But I'm just, the $1 million of hygiene is extraordinarily alluring. It's not $1 million. It's not the same as $1 million of Dr. Jones producing the money.
Yeah. And it's alluring back to what we were saying, back to any dentist can step in from an investor standpoint or succession standpoint. And right. And again, the caveat is, I know you're not trying to sell, but think about it this way. The build to sell model is a happy one. So anyone could, if you have a $1 million hygiene program, any doctor can pretty much jump in and maintain that $1 million program, correct?
Of course.
Right.
Yeah.
But if you have a $3 million program and a $500,000 hygiene, and you're doing 2.5 because of these, all on X and FMRs and changing verticals and, pterygoid implants and shit like that. Like,
how do you
that's pretty hard. No one can come in, not no one. There are very few unicorns out there that could step in that want to buy your practice for market value from a succession standpoint.
Yeah.
And Craig, I want to make clear, I'm not saying don't do that. I'm just saying that there's a cart and there's a horse, and like, try not to put one before the other, right? Meaning that I think from a foundational standpoint, it's fine to do that once you check the box on a lot of the things we've already talked about, these aforementioned. It's fine to go seek the Elon X and this specialty thing, but make sure that you are robust in your restorative, you're robust in your hygiene, you're robust in your just general marketing as a whole, that your pipeline there is good, meaning that you say, hey, our goal for new patients is this. And then whatever I get from that, great. Right? Let's say your goal is 60%. If you're 60 new patients, if you're meeting your goals, not waiting for these home run pitches to come in, the 4 home run pitches that come in every year. I've had those months, but I got to tell you, it's really stressful. You have a fantastic month and then you have a shitty month. You have a fantastic, it feels like Bitcoin. It's all over. The volatility is no fun.
Sounds no like fun. Some pain there.
Right. And so how do we reduce the volatility? All the things we just said.
Yeah. A stable business is a good business. If it's the 29th day of the month and you're trying to swing for the fences to make the month work, that's not fun. And when you say built to sell and all this stuff, and I just want to, refine that narrative a second, because a sellable business is a profitable, stable one. So when you have something that is attractive to be sold, you don't want to sell it. You actually
totally, and that's the whole thesis of the book, right? But what I'm saying, built to sell, when I say that too, I also mean, and we talk about this a lot in the mastermind, right? The partner who's buying in. So that is a fractional sale. That is a liquidity event. Typically when you're getting associate to partner. And so even to their eyes, the people that they will use as their counsel will look at these numbers and say, yeah, this is a good practice. Or they may look at it and say, hey, Dr. Jones is the one making all the profit. Like,
right.
You have an existential risk. A key man risk. So not even built to sell in totality, built to invest is maybe what we should say.
I love that. Build a model that's built to invest. Yeah. Build a model that's so good that people would want to readily invest in it.
Yeah, but it comes with, how do you get to those levels of the hygiene program? You create incentive models, right? The better they do, it's like we call it here, like the triple win. Team member does well, the business does well, and the owners can do well. And it's a three-legged stool. Everyone has to do well. Without that, the things fall. So when the business is crushing it and ex hygienist is making the exact same every month, of course. So, that's where I think it's great, where the summit is great. We spend a lot of time when people bring their teams and we kind of talk about the hygiene compensation models, and it really gets teams aligned. Like, what's it going to take for everyone to be full charged ahead with this new mission, right? They come with a little bit of confusion to the summit. They come with some alignment. I mean, you have to have some alignment to actually come there, because the doctor wouldn't have invested, but doctors make this investment. The teams sit down and they talk about, like, hey, here's our transparent goals. And when you can do that, it's easy for the doc to say, hey, when I reach X, I'm willing to do Y for you, right? It helped me out what I'm trying to say.
Well,
It's
listen,
just easier when there's
multi. It's like, number one, you have to have alignment. So if a hygienist goes off and starts talking to a patient about something that the doctor doesn't feel is important, you're going to cause friction. So like in the very basic steps, what we'll teach you is like how to define a healthy mouth, how to get the guardrails so that the hygienist can have the freedom to have these autonomous conversations and treat the patient the way they want. So there's a lot that goes into it. It's not just just like setting people out to take charge and do what they want. So it's alignment, it's leadership, it's patient influence, and it's also just it's just doing what's right for the patient. If I once said to a mastermind, or remember, like, they were saying that they don't offer perio or whatever, they don't offer any types of perio services. I actually told that mastermind, I said, like, listen, I would not go to your practice as a patient. I want to know what's going on in my body, my mouth. So I think the first step is just getting alignment, defining what's a healthy mouth, and then getting your team, specifically your hygiene, to be on board with it. And I think that one of the biggest traps that most dentists fall into, and I'm going to ask this of the audience, if you are a unicorn provider, if you do things that are very rare and difficult, and you're that level of provider that takes on extraordinarily difficult cases, and you also want to be scaled and grow out of the chair, you're setting yourself for a very difficult problem. So if you're young and you don't really have your career very well defined yet, but you want to exit clinical dentistry at a certain point, or grow to the point that you have multiple doctors or multiple providers working for you, it's probably not going to be a logical thing for you to become the unicorn producer. Like, remember when Blake asked? Yet. You can, once it's built, and now there's a lot of general dentistry, a lot of hygiene, there's a lot of activity. You can go in and pick off the upper point of that pyramid and do the all on X,
or you can just eat the glass and like not learn from me, meaning like I did not yield that advice, Craig, and early in my career. Neither. I went out and tried to be the hyper specialized guy and only come to me, and eventually you get enough pain, whether economically, financially, whatever it is, that you're like, maybe this volatility in my life is not healthy. Maybe this volatility in my business, maybe this stress is what's going to burn me out. It's not going to be holding the handpiece. It's going to be the volatility of my business. And that's what I'm saying. I think building this creates sustainability in the business. It creates longevity. It creates happiness. Because very few of us burn out of dentistry, Craig, from a hand injury, right? Or a back injury. It's more like you're just done. You just can't deal with one more drama. You can't deal with the stress. Your cortisol levels have been pegged since you graduated. And you've never had a day off, a mental day off, because you're constantly thinking about it. So eventually your dream, everything just you just can't take it anymore. And that's where we see the burnout happen. And so the goal here isn't to give people advice to say, hey, do this, don't do this. I think that you and I just had enough, we've done it wrong and then done it right.
Right.
But we learned, and we're trying to instill that like dentistry done right, I think could have much more longevity than what I see people do. And I'd love to hear from you. The people I talk to, when they start talking to me about this burnout, I ask them when they graduate, and invariably that time frame is about 15 years.
Yeah.
Right. Which is crazy, right?
It's such a trap, though. It's such a trap, Peter, because the normal progression is to get out of school, educate yourself, become the apex predator, and then be so happy that, oh, wow, now I'm the unit economics. I'm no longer a composite king or a composite queen. And now I'm doing quadrants and now I'm doing FMRs. You feel glory. And all of a sudden you're like, wait, is this all there is? And then you can't scale because you've built the unicorn job for yourself.
I think that's part of it. I think that's a portion.
Like, I look at the
burnout.
Tesla analog with that. It's like the Model X and the basic Tesla car is the scalable component.
You know, you bring up something really good with that Tesla comment, actually. Here's the beautiful thing, which we have to remind masterminders. You have permission to change.
Yes,
you have permission to pivot. I think, Craig, we feel like we get locked into a business model and like we can't deviate because that looks like a vulnerability to our team. But like you get one ticket, one chance at this. If something's not working, figure out the skill set and pivot, right? Maybe this was the inflection pod that you needed to hear to say, hey, you know what? I am tired of this volatility. I'm not going to, put my all in X to the side, but I'm going to put it on ice for a second to get robust in X.
Right.
Or Y. We're using all on X and model Ys, and then I'm using these metaphors X and Y. It's a little confusing.
Well, it is funny. The all on X and the X model Tesla are both the premier high level. Need a salesperson for it.
Right.
And Elon's is like, you know what? Done. Go somewhere else. Go buy an Escalade.
Maybe we should call it all on Y from now on.
Yeah, that's what it's gonna be. It's all on Model Y and all on Model 3s. Yeah.
But yeah, I like where this landed because I think it, we get into dentistry because I think the biggest thing that attracts people to dentistry is the autonomy. I think also that becomes the noose around your neck because everything's an option. It paralyzes you when you actually get into function a little bit. It's like, oh shit. And maybe I shouldn't do this because now I have these school loans and now I have this. Like the thing that attracted us was I can do anything, right? I have this autonomy. I will never have a boss. No hospital will tell me what to do.
Right.
And then you get out and you're like, shit,
I got to do it.
I don't know what to do now kind of thing. So I'll just work harder. Let me set this treadmill faster and faster and faster.
Right. But I do love what you said. And that's one of the things we take people through in the mastermind. We get to witness these transformations. You got to break the narrative. You've got to really reevaluate it. And if it's not working for you, amazing. You can change. Yeah. Good for you. You can change. Yeah. You can change.
Like how many times has your philosophy of your business model changed?
My word. Like at least 6 times.
Yeah.
Like I would look back to what
3 big categoric changes in the direction for me, for sure.
If you would have asked me 5 years or 10 years ago, what's my number one focus in business? You know what I would have said, Peter?
What?
How do I get my oral surgeon busier? And I love all of my oral surgeons, but there's a, I don't know if this is the same for the listeners, but I've heard of oral surgeons not wanting to take, 32 or 35% of their collections. I've heard that they want 45 and 50%. Yeah. So if I'm going to feed that animal, it's like there was a skit on Saturday Night Live and it was so funny, but painful for me at the same time. It was a spoof about a bank that only changes money. Like, it's like, hey, welcome to Change Bank. Let's say you're like, need a quarter for your parking meter. We can do that for you. 4 quarters for $1? No problem. 4 or 5s for 20. And then people always ask us, how do we make money doing that? And even the guy's like, we make it on volume. It was a total spoof. I'll find the video for you and send you. But it's like, people always ask you, like, you don't charge a transaction fee. You just change money. How does Change Bank make money? Volume. And that's what I used to do. Like, I'll just make it up on volume.
The more busy you can, the more volume, the more implants you can send.
Yes. So funny. Well, look, so painful.
I think we've hit this narrative. It's funny. We started with a sales conversation and it morphed into permission to change and look at the volatility in your life. And if you don't love where it is, maybe look at what Elon's doing.
Yes.
It's always good to follow a future trillionaire. Yeah. Like, what does he think? How would he address dentistry? I'm going to go with the trillionaire's advice.
Right. And just to land this thing one last time, he's cutting off 2 amazing machines.
Not problematic.
They're not problematic. They're, it's just like, okay, it's only 3 to 5% of our top line. And they're really cool. But he sees an
arbitrage of highest and best use of that factory is robots now.
Right. So it's like for you as the dentist, your FMRs, but your back is hurting, you can't handle it, your adrenals are pegged, like you said, and you're freaking out. You can get rid of all of that and just start doing something else. You don't want to do a cold turkey. Don't stop doing it tomorrow, but slowly start building other things until more than 50% of the work is now out of your hands. And then you can optionally cut it out if you want.
You know, and Greg, I think someone would be like, oh, what you guys are saying is great, but like, I don't know how, right? I only know what I know. I only know what got me here, right? The skill set that I know got me to here. So how do I go back and maybe readdress some of that volatility? And I think it's a pretty easy thing to do. And I can sit here saying that as someone who's done it.
It is easy.
Right. I think it's much harder than creating a practice that thrived on the all on X. Like you said, the high specificity of that marketing, the high specificity of the procedures and this and that. The success or failure is super binary.
Well, you know why it's easier than it is, and people think they'll tell themselves.
So my point, hold on, let me land that. So if you got there, you definitely have the chops to go back and stabilize and simplify and streamline and all these things and get rid of that vol and give your adrenals a rest.
Yeah, well, you know, the most dentists that are hearing that, like you telling me, Pete, I have to start over. You're not starting. You're not starting over. You're not starting over. You're not the same person you were. You understand the business. You understand patient management. And if you can manage full mouth patients and all on X, holy smokes, you can manage doctors doing quadrants.
So that's a great point, though, too. Like you may want to look at, this is a point where you can look at being good with the numbers. And if you look at like, so Elon, not to keep using him in this analogy, but he maybe okay, he wants to use it for robots, but he might have looked at his unit economics and say, hey, we make more on the model Y than anything, right? And so you and your dental practice may want to look and say, hey, we are really, really good at SRPs or our crowns or whatever it is, and dive into the unit economics of your business, as opposed to letting there be, that was a home run month and that was a shitty month based on how much implants went in, so to speak. So really getting to know the business, right? I always tell someone, if you don't, to tell people nowadays, Craig, like if you don't know your business, upload some of your documents, redact some stuff that may be important, upload it to make a custom GPT, upload some of this and just chat with it. Have it educate you. Hey, what does this mean? I think we're so afraid to ask questions that now we have these supercomputers that can help guide us through, what does this mean, right? And explain this to me as I'm 5. I mean, I can't tell you how many times I'm like, explain this like I'm a 5-year-old. It's like, okay, here you go.
You have 2 crayons today. Your friend takes one of your crayons.
Yeah, well, kind of, right? But like start there and like learn the business and really dive into that aspect of it, just probably like Elon did. Be like the trillionaire. Yeah.
I just, I want to, be respectful of your time, Peter. I know you got a hard stop, but I do think that there's an inordinate amount of pain in dentistry. And the pain comes from a narrative that people are following, and it's a prescriptive narrative, and they get to a place that they don't want to be. And my most important wish for you is that no matter where you are, you can pivot, you can grow. Dentistry is an absolutely amazing profession. You can do whatever the heck you want. I'm having a conversation with one of my doctors right now, and she doesn't see how it's possible, but she wants to go to sleep dentistry and just make sleep appliances. There's people doing millions of dollars a year doing that. It's totally conceivable, but it doesn't happen overnight. But you just got to get clarity on what you want to create and then start slowly chipping away and building that. But if you have a resilient, basic business behind you, basic meaning hygiene driven, restorative driven, you are inherently bulletproof.
And a great pipeline of new and great retention of old. Right. That is the thing. And right, your RIA points, all the things we teach at Bulletproof, like get that stuff buttoned up and then go to sleep medicine and then go,
add on top of that base, that strong base.
Love it.
Want to make a quick mention. Last year's summit was entirely sold out. I got calls from Invisalign reps and Patterson reps and everybody saying like, just put this one extra person or 2 extra people in. And it was a fire marshal thing. We could not fit the people. So there are seats left. This is August 7th, 8th at Scottsdale. This coming August. And don't delay.
At the Phoenician, which I think I told you when I tried to book it recently, it was $900 a night. and we have rooms for 150.
Yeah, the 1990s called and they want their $150 hotel room back. Yeah, that's awesome.
It's pretty spectacular. I talked to Chris Alpers before booking this from the thing, and I said, "Hey, is this like the best hotel there?" He's like, "Dude, it's like hands down our best resort." Awesome. So make an experience, bring your family. But Craig's right. Like this is not hocus pocus. This is not us like trying to sell the summit. It literally, we had to make concessions. I think we were probably in violation from a fire code.
You can say that now, sure.
Yeah, who cares? I don't think we were actually. No, I don't want to go on record. We weren't. But for sure, like make it happen and plan now, because it'll be really hard to make concessions. And it's not, I think we're around the same capacity as last year, meaning from a ballroom size, correct?
Sure. And I also want to talk to the 50 or so doctors that have registered alone without bringing any team. The most common comment I hear at the close of summit is, damn it, I really needed my team to be here. I didn't realize it was all this team content. Because listen, you get fired up, you come back Monday morning, it is powerless. It's not knowledge, it's power. Execution is power. So without your team there, listen, great. You want to dip your toe in the water, but I can guarantee you won't be upset you brought your team. So if you're one of those 50 doctors that have already registered without their team, at least bring one key person. Ideally bring them all, but at least bring one key person.
I also think, Craig, you and I, before we record, one more further announcement. We are going to be bringing on more guests, more of our mastermind coaches. We're going to probably bring on our new CEO. We can probably talk about him. He comes from the world of marketing and AI and things like this. He's a non-dentist, but he has amazing context. So he may be visiting the pod, and yeah, it's going to get interesting. We're going to kind of go do a tour and probably even look, if you listening would like to come on the pod and we could maybe live workshop.
That'd be very cool.
That's potentially open. We'll bring on some of our masterminders from the growth and the masters section. But we're going to be bringing on more guests in 2026 and really trying to do some live problem solving and things from different vantage points, right? Problems.
I would love
from
to have
vantage points.
a listener on. So if you're a listener and you've been listening for a while, email us. We'd love to get you on.
Yeah.
Kind of sort through your problems live. That'd be very cool.
Be great. Okay, buddy.
Awesome.
Good stuff.
Thanks, Pete.
I'll talk to you later. Everybody, we'll see you guys over and out. See you next time.
See you guys.
Thanks, everyone, for watching today's episode of the Bulletproof Dental Practice Pod. We hope this conversation brought you a tremendous amount of perspective and reminded you of why you love dentistry. If you enjoyed this video, make sure to smash that like button, drop us a comment, and make sure to subscribe so you never miss a future episode. Additionally, it would really help us if you could send this message to someone that you think would enjoy it. Until next time, keep pushing forward, keep leading boldly, and most importantly, stay bulletproof.